Hi, guys. Welcome back to the Chronic Chronicles, the podcast where we dive deep into the lived experiences behind chronic conditions, sharing real stories and science backed info. I'm your host, Lexy, and today we're joined by Megan, an incredible advocate in human navigating both endometriosis and EDS. This episode is brought to you by Period Aisle, the OG of reusable, sustainable period products. Whether you bleed heavy like me or you just need a little daily coverage, their period underwear, pads, and liners have got you covered. Literally. They're comfy, they're cute, and they're sustainable, and they're made to actually work. I wear mine during endo flares, overnight, and honestly, anytime. I just don't feel like dealing with disposables. They're better for your body, and they're better for the planet. You can use code Chronic Chronicles for a discount at periodaisle.com.
Hi everyone, I'm Megan. I live in Cleveland, Ohio, and I am a colorectal surgery nurse.
That is so cool. I So what exactly is that for people that might not be like in the health field?
Yeah, so colorectal surgery deals with butts and guts is how we like to describe it to kind of simplify it down. So I work in an ambulatory setting where I kind of help the surgeons room their
Mhm.
patients, help with bedside procedures, things like that. So it's a lot of fun. There's the inpatient side that deals with postoperative patients coming in with postoperative complications, but I'm on the outskirts of that.
Cool. And how long have you been a nurse? Like,
I've been a nurse for a year, but I worked in healthcare as a nurse assistant for 5 years prior to becoming a nurse.
okay. So you've done like the long schedules, the 12-hour
Yes.
days for a while.
Yes.
So you're kind of a veteran in that department. Okay, cool. And you have endometriosis.
I do. I have
When were you first diagnosed with endo?
I was first diagnosed in 2020.
Okay.
So I
Ew.
went in
Peak
for
COVID.
a would you say I'm sorry?
Peak COVID.
No, it was shocking. I fell down the stairs in May. I had to have a shoulder reconstruction done.
Oh my God.
And then while I was in the hospital for that, like I got discharged and I came home and I got appendicitis almost like a few weeks after. So then I had to go back in for surgery. And
Oh my
for some
Lord.
reason, while I was there, we were doing like an ultrasound. And then that ultrasound turned into an intrapelvic ultrasound because they thought they saw something on my ovary.
Mhm.
And then that intrapelvic ultrasound determined that I had a mass on my ovary. Yeah. So then they sent me to see my gynecologist who ordered some blood work. And at first, they were concerned for like ovarian cancer. And
Oh my God.
then the doctor took me to the operating room and was like, no, it's an endometrioma, completely benign. So I was diagnosed after that procedure. Uh,
Hmm.
but I began having symptoms when I was 15 years old.
Oh my gosh.
So I went a really, really long time without a diagnosis. I got my period at 10, which back in the day, that was like really early. And I didn't really realize that. I didn't really realize that people my age weren't getting their periods. And then 15 kind of rolled around, and I was like, I'm throwing up, I'm passing out, I'm having to miss school, having to miss activities. And other people my age really weren't experiencing that. So I went to my mom and I was like, Mom, I just don't feel normal. Like, this doesn't feel
Hmm.
right. So she
Yeah.
took me to see an OB, and I just remember that OB looking at me and being like, You're too young. There's no way you have
Mhm.
endometriosis. Like these are normal womanly symptoms. This is going to go away. We're going to put you on birth control. And of course, at the time, I was like, Okay, like, she knows best. I thought I did my research. I brought my concerns to her, and, this is what we're moving forward with doing. So I got on birth control, and I was on birth control for years.
Yeah.
Um, so my symptoms were pretty managed. I would
Yeah.
say like the heavy periods got less heavy. I was still having a lot of nausea, vomiting, dizziness and things like that, but I wasn't at the extreme that I was at prior. Uh,
Yeah.
but I just knew something wasn't right. So
Yeah.
I just kept, I
Kept
think I
pushing.
went to 5, 6 OBs and I was like, someone please help
Wow.
me.
So do you remember when you were like 15 and you went to this first OB and they told you that you were like too young for endo? Do you remember if you guys brought up endo or if they brought up endo? Because I
No.
I like think back to mine and people are like, Do you remember like how endometriosis even got brought up? And I'm like, actually, no. Like, I don't know if like that was me or if that was them or
Yeah.
what. But
I very vividly remember like looking up on the internet, is it normal to be passing out on your period?
yeah,
Like this, and endometriosis is a something that came up while I was searching for things. And so then I dug further and I was like, I have so many of these symptoms, you know?
yeah,
And so I actually went to that appointment to discuss that solely. Like I wasn't going in to discuss birth control. I wasn't going in to discuss, I was going there specifically to be like, I think I have endometriosis
yeah.
and I want your help kind of sort of thing. And I was
Yeah.
immediately shot down.
Aw, little like baby 15-year-old Megan, and you're like, I want to talk about this. That's amazing, honestly, as a teenager, just like doing some research yourself and going to your doctors and asking them about it. But it sucks that that's such, unfortunately, like a common experience that people with endo deal with is being shot down
Yeah. And
with
I
their health.
think I have a pretty extensive health history. I spent the first years,
Yeah.
3 years of my life in and out of the hospital. I was diagnosed with Ehlers-Danlos at 11.
Hmm.
So, I kind of had been in all these appointments, which again wasn't something that people my age were really
Yeah.
doing. So I feel like, it kind of gave me an advantage of being able to learn how to advocate for myself very early on.
Yeah.
I was very familiar with going to the doctor and being in those sorts of environments, but that was the first time I genuinely felt like I wasn't being listened to, which really stunk because you're in so much pain, you're so uncomfortable, and you're like, just something
Yeah.
isn't right. And then someone
Yeah.
looks at you and goes, no, you're too young. There's no possible way.
Yeah, I know. I feel that. When you're at like such a young age, like 15, like these like formative years, and you're being told by people that like in reality you look up to, like healthcare providers, like you do, like I don't know, I feel like most people just naturally, like there's no reason to not believe them or not like listen to what they say. So that can really do wonders on your healthcare, like or your mental health.
It was the first time I started questioning, like, okay,
Yeah.
is this all just I don't
Hmm.
know. It was the first time I really was like, okay, maybe I don't know what I'm talking about. Maybe
Yeah.
what I'm feeling really is just a normal thing, you
Yeah,
know?
maybe my pain tolerance is way lower than I think it is, and like
Yeah.
everyone else can just manage better than I can, and maybe I'm being dramatic, like they say I'm being.
All of the things. Yeah.
Yeah, unfortunately that hear it all the time on the
Yeah.
podcast, and it sucks, but that's what we're trying to do is just
Yeah.
bring awareness to it.
Awareness. And I think it's super important. And I also just want to say shout out to Taylor and Emma that
Hmm.
you're friends with because
Yeah.
I started following them and they're the reason that I found my endometriosis specialist because until I started working in the job I'm working in, I didn't even really know that endometriosis specialists were a thing. So like I had gotten diagnosed
Yeah.
with it in 2020, but like my symptoms were still there. Like I was like, what is going on?
Well,
Had I, sorry, go ahead.
question
Hmm.
not to like cut you off, but when you had your surgery, with this was with an OB, right? Like it was,
Yes.
and what kind of surgery did you have? Well, they didn't really know that it was endometriosis. They were just going in, so it was just like a laparoscopic.
Yeah. So the time at the time it was like an exploratory laparotomy
Yeah.
just to look and see what the heck was going on in there.
Yeah.
Um, and they had found the endometrioma. It was like 7 centimeters on my left ovary. Yeah, it was
God.
huge.
Ow.
They call
Yeah.
them chocolate cysts, which is very interesting. Um,
I've heard that before, and I'm like, that's kind of gross, but okay.
So my surgeon actually showed me a photo and I was like, I mean, it makes sense. Like it
Yeah.
literally looks like a Lindor. I'm sorry for people who may not eat chocolate if this description, but
Yeah.
that's literally what it looks like. So all they did was go in and remove that
Hmm.
endometrioma from my ovary.
Yeah.
They didn't do any further investigation anywhere else.
Yeah,
Um,
they probably didn't touch any other endometriosis, which that is kind of not to tell, I've told this on the podcast before, but that's kind of how my situation was too. Like I didn't know that specialists existed. I was in the UP of Michigan, so like we don't have specialists there.
right.
Um, and got mine was supposed to be an exploratory surgery just because I like was pushing so much to
Yeah.
just see. And then my doctor was like, she was an OB, and she was like, just so you know, like, I can do some ablations of like what I see, but like this isn't gonna do much for you other than like potentially give you a diagnosis or tell you that it's not there. And she was like, so, like surgery might hurt you more than it helps you because you have to heal from it. And I was like, whatever, just do it anyways. Because like I didn't even know that excisions existed. No one
Hmm.
told me anything about that or that specialists were a thing. Um, so yeah, I kind of just did the surgery. She looked around, did like a couple of ablations, burned off a
Hmm.
couple things, but then closed me back up. And obviously I was still in pain.
Yeah, right.
Yeah.
And I went back for in 2020 because I had a 9 centimeter endometrioma that regrew on the left ovary.
Oh my
And that time
God.
I went to a fertility specialist, and him, along with my OB, they did the procedure together. And this time I remember waking up and then being like, it's everywhere.
Mm.
And in my mind, that meant to me that they had taken care of it. Like when you're under that anesthesia and you're waking up, like you're
Yeah.
not fully understanding everything.
Yeah.
Not until after I went and looked at my op reports did I realize that the only thing, again, that they went in there and did was took out that mass.
Yeah. And now you're
And
like, I've had two surgeries. And yes,
yes,
they did something, but like not really, like not
yeah,
enough. Whereas you could have seen a specialist and they would have done way more.
right. And so
Yeah.
then I started working in the ambulatory setting in 2023. And
Hmm.
one of the surgeons that I work closely with works with patients who have endometriosis. And he goes, oh, we're going to send them to this doctor. We're going to send them to this doctor. And I'm like, wait. We have somebody here that specializes in endometriosis. And he goes, yeah. And I was like, I need to see her right now. Went in, I saw her in March. I had surgery with her in September. It was supposed to be about an hour and a half procedure, ended up almost being 5 hours. My fallopian tube got removed because of the damage that was done. And it was everywhere. My rectum was being pulled to the left. I had a large mass in my pelvic floor. It was just everything down there was entangled. My ureters, my bladder,
Yeah.
some on my bowel. And, I remember waking up from that surgery and just being like, finally, like it's finally, I mean, endometriosis is never gone. It
Yeah.
always has the
Yeah.
potential to grow back, but
But
I
they actually
discovered,
like did something in that surgery that you might be in a little bit less pain.
yeah. And
Yeah.
that's exactly what I've experienced. I mean, I still have a lot of symptoms, especially around my period, but I think it's night and day difference from
I
what it
love
was
that.
prior to that procedure happening. But in those moments, it just felt surreal, like this is finally happening. You get so
Yeah.
emotional, and I remember crying so many days afterwards. Like, I just feel so relieved that I finally found someone that one, not only believed that there were other things in there, but then took
Yeah.
me to the operating room and did something about it. And nothing against my surgeons before, but the way
Mhm.
that my surgeon described it to me, the specialist, she said, they're just not trained. Their eyes are not
Yeah.
trained to see it. It can show up differently, even in different parts in the same body. So you
Hmm.
really have to know exactly what it is you're looking for. The other
Yeah.
two surgeons were fantastic. It's just, you
Yeah.
need that specialist to take care of it.
That's kind of the same situation. Like I said, like my OB, I mean, she told me, like, granted, I was like 19, 20, so I don't think
Mhm.
I was like really listening. Now I'm 27, like I've had some distance from it,
Yeah.
but I just was really angry with her for a long time because I was like, she just didn't help me. Like, she didn't listen to me. She didn't help me. But and I still do agree with that, but also she did tell me that she was not trained for that. She's like, I am not an endometriosis doctor. I'm an OBGYN. I deliver babies. Like, I will do your surgery and I'll look for endometriosis, but there's only so much I can do. But
Yeah.
even that, like, I mean, she did diagnose me with stage 4 endo and she was like, yeah, you got it all over the place, but I could only
Can't.
get what was right outside of your uterus. Like, I'm not going to go exploring. Like,
Yeah.
she's like, I saw stuff with the camera, but I'm not gonna go like try to burn things off like all over the
Mhm.
place. She's like, I just don't feel comfortable doing that. So yeah.
And I think that's something that's not really like talked about either is like the grief that comes with like processing everything. Like
Yeah.
this whole life that you've suffered and that you fought and that you've tried to get somebody to believe you and that one person finally does, but it doesn't take away the fact that you had to fight tooth and nail to get to that point. And it's like you have
Hmm.
to grieve that person almost. Like I remember telling my boyfriend, like, I am grieving this person that I was before because it's like she had to fight so hard to just get to
Hmm.
this point here and to be believed and to have something done about it. And it just,
Yeah.
the grief that comes with endometriosis, the diagnosis, the procedures, it's massive.
It's a
It's life
lot.
altering.
Yeah. It's a lot. It's a lot. I want to ask, like, were there moments, I guess I don't really know how to ask this one. When you, like, what's the timeline of you getting diagnosed and having all this stuff happening and you like doing nursing school and deciding that you like wanted to work in the healthcare field?
Yeah. So I knew from a very young age that I wanted to be in healthcare. Like when I was 3, 4 in the hospital, like on holidays and getting stickers and like going
Hmm.
through all that stuff, I was like, I want to be this person for somebody else that's going through the worst possible thing in their life, you know? And I
Yeah.
didn't really know what that looked like. At first, I wanted to become a doctor. And then I was like, maybe that's not for me. So then I left school. I came home for a little bit. Became a nurse's assistant in 2018. In 2019, I was like, okay, I think I'm ready to, navigate nursing school. So I applied. I got in May of 2019. My diagnosis came in 2020. And at that point, everything was online for school because of COVID.
Yeah. Yeah.
So, and I wasn't in my clinicals yet. I was still going through like my prerequisites. So, everyone was pretty understanding. We were at home anyways, so everything was online. So I was
Yeah.
just kind of doing things. I didn't really necessarily feel the effects until we started our clinicals and things like that. I was in a fast track program that should have taken me 3 years and it took me 4 or 5, which there's
Yeah.
absolutely nothing wrong with that. But because of some of my procedures, it definitely did set me back. But I
Yeah.
wouldn't change it because I needed those things. I
Yeah.
needed to take that time for myself to give myself a break from the pain and the symptoms that I was experiencing. So it definitely hindered my ability to kind of get through school the way that I wanted to and like what that looked like for me. But
Yeah.
I made it through. I graduated in December of 2023 and was it was all good.
Yeah. Just takes a little longer. And that's okay too. Like, I mean, it sounds like you were advocating for yourself like through that to get more, which is good. We're like as a healthcare professional now, work and
Mhm.
I realize that you don't work with people with endometriosis or anything like that, but you still have like a vast medical background. Do you feel like this kind of like help or oh my gosh, do you feel like this helped or hindered you when you were seeking care for endo?
I feel like it was kind of a double-edged sword, if I'm being
Mhm.
honest. Like it helped because I knew how to navigate the system, which is
Yeah.
something that, I feel for so strongly for patients who don't work in healthcare because they don't see the back end of things.
Yeah.
But I feel like it definitely helped me in that capacity. Like, I'm not giving up. I know that there's resources available to me. I'm going to be that squeaky wheel till it gets the oil, that sort of thing. Like, I know how to continue to advocate for myself. I think that where it hindered me is because I knew those things and I wasn't getting the help that I needed. And it was so
Mhm.
frustrating. And there's also this like unwritten rule, and this isn't every doctor, but like I've met so many doctors, surgeons that are like, oh, she's a nurse, she thinks she knows everything. And so it's definitely hindered in that capacity too. Like if I even get a hint of that feeling from a person that I'm sitting across from, like seeing, I'm like, no, I'm
Yeah.
done seeing you. Like I don't, we could work together. Like I'm trying to come
Yeah.
to you with this knowledge that I have and you're shooting me down. Whereas I've had
Yeah.
other people that are like, oh, you're speaking my language. Like
Yeah,
let's
like let's be more collaborative. Like I can
Mhm.
explain things to you in an easier way
Yeah.
because you kind of already know like some of these health terms and like yeah, yeah, I get it. Very
So that it's been interesting. It really has. I mean, it's like I said, it's a double-edged sword. There's pros and cons to
Mhm.
being a healthcare professional yourself when you're navigating also being a patient.
Yeah. I know that now you're more in the ambulatory side of things, so your shifts are like 8 hours now, right?
Tens, four
And
tens, yeah.
4 10s. Okay, those are so long. But how do you manage like, I mean, even the 10-hour days? Like, how do you manage long shifts and like physically demanding work while you're dealing with like endo symptoms? Like, what happens if you have a flare while you're at work for 10 hours? How do you
Yeah.
manage that?
Some days are really difficult, and some days
Mhm.
I just have to go to my team and be like, I need to leave. Like, there's no
Yeah.
possible way. I do my best to show up, um, even when I'm having a lot of pain, because some days I can get through it. Like,
Yeah.
some of my clinics I'm so familiar with that I know exactly what to expect. I know exactly, what the day is going to look
Mhm.
like in some capacity. And so I'm like, okay, I think I can manage this and I can go home when my clinic is done. But some days are just, you
Yeah.
just, there's no getting past it. I've had to call off some days. I
Mhm.
go in some days and I'm like, this isn't working and I leave early. But a
Mhm.
lot of times I just make sure that I have my compression socks on, because we're on our feet all day. I make sure I'm drinking water and eating smaller meals throughout the day more frequently, which
Yeah.
is easy to do because of the setting that we're in. I can kind of step out really quick, eat something, and then come back to what we're doing. It's not like we're on the floor and you're constantly being called and answering and giving pain meds and all of these things. So it's very different in that capacity. When I am having a flare, making sure I have my heating pad, my, CBD cramp cream, my all of these things, my
Yeah.
ibuprofen, and it's when those things don't work that I know,
Yeah,
it's
I can't.
time
I can't
to,
get through it.
yeah, it's time to
Yeah,
pack the bags.
it's kind of I was kind of similar when I worked like all through undergrad. I worked in the dialysis unit,
Hmm.
which we worked 12-hour days, and I know that you
Tough.
and I kind of like talked a little bit about this, but like dialysis is kind of weird because like the doctors only come like once a month and the
Yeah.
nurses kind of like take on more of like a doctor role and the dialysis techs take on
Mhm.
more of like a nurse role. Like the
Yeah.
techs, what I was doing was I was the person that was always like the machines are beeping and I'm the one that's going to it. I'm the one that's doing
Yeah.
vitals and giving meds. So I was running around literally for 12 hours.
Yeah.
And I remember there was one time where like we were so understaffed that like I couldn't go home
Mhm.
because that we literally had patients. They're like, I'm so sorry, but like the
You
patients
have
come
to stick
first
it
in
out.
this. And I'm like, okay. And I was like so nauseous from like being in so much pain that I would like just go to the bathroom and puke and come back and like take my
Mhm.
patients off the machines and everything. And I was like, yeah, I don't think because I wanted to go to medical school and I was like, I don't think I can do this like forever.
It's hard. It really is. It's part of the reason why I left the bedside.
Yeah.
I never was a nurse at the bedside. I give so much credit to the nurses that are, but for me, it just wasn't. I was like, if I want to be a nurse, I have to find something that's more functional for me and something that allows me to do what I love to do, but also
Yeah.
gives me the flexibility of taking care of myself and not being under that constant stress. So leaving the bedside, I loved the bedside. I loved the busyness of it, the patients. But for
Hmm.
me, in order to take care of myself and to have a balance in that, now I'm in this job and I absolutely love it. I can't see myself,
Yeah.
being anywhere else.
This episode is brought to you by Octavia Wellness, the company behind my favorite CBD suppositories for pain and pelvic support. Whether you're managing endo, period cramps, or just a tense, tired body, Octavia's clean CBD products bring real relief without any of the junk. Their relief suppositories are a game changer for deep pelvic pain. You can check them out at heyoctavia.com and use code Chronicles at checkout for a discount.
But it
I love
was it was difficult. Those 12-hour
that.
shifts, they get to you. I would be so swollen, so puffy, just the brain fog, the depression,
Hmm.
it was at an all-time high.
Yeah, I feel you. I just remember being exhausted like all the time. And I was, I felt like I was in flares like 24/7. And that was also before I like discovered literally anything other than ibuprofen.
Yeah.
I mean, a heating pad, but like I didn't know that like sticky like heating patches
Yeah.
existed. I didn't know like cramp cream was a thing or like CBD or I just no one ever told me about my doctors
Yeah.
were just like take Tylenol and ibuprofen and I was like okay so I was just popping those things like candy 24/7 um but yeah I those days are definitely hard um and I feel like we kind of already talked about this a little bit but are there any specific like workplace accommodations or strategies that have like helped you? I mean I know you mentioned that if you're absolutely feeling like shit, you have the ability to go home sometimes.
Mhm.
But other than that,
So FMLA is an option,
hmm
thankfully through my workplace, which, you can either get full-time like FMLA if you're having a procedure and you're out for extended periods of time, or in my case, I have intermittent where I use it on days like this where I may not be able to come in, I can't get out of bed, that sort of thing.
yeah.
I also am very blessed with a management team that is very for work-life balance.
Mhm.
When you're at work, it's very much work. You get your
Mhm.
job done, but they also believe in having, an outside life, and
Yeah.
they understand that things happen and people are dealing with things that aren't work related and that it's not
Yeah.
work 24/7. And I think that's been another huge thing is just being surrounded by a team that I not only feel supported by, but also seen and heard by, which is not very common, I feel like, in the healthcare world.
Yeah.
I've never
True.
had a extremely poor management team, but this team has definitely been some of the best when it comes
Yeah.
to understanding that life is life and there's things out
Have
of your
you
control.
have you like told, I guess people have asked me this before, but
Mhm.
like have you disclosed to like your boss or your manager or whatever that you have endometriosis and like when did you decide to do that?
I'm very open with it just because
Mhm.
of sometimes the symptoms. Like I still do pass out sometimes. I still do throw up.
Yeah.
And, sometimes when I need to step away for those things or I'm not feeling well, people having this knowledge that I have this condition allows them to better help me. And
Yeah.
it allows the team to not be like, okay, she just keeps walking away. Like, what is going
Yeah.
on? It's like,
Yeah.
I'm in a flare. I don't feel like I have to hide this from you. And I was pretty upfront. I didn't disclose it immediately. I
hmm
was also very nervous that it might hinder my ability to get hired.
hmm
And now knowing the team and everything like that never would have been an issue. But, that's something that you fear.
Yeah, 100%. I mean,
And
I
so, sorry,
I
go ahead.
did like even applying for jobs post grad, like technically I can look this up, but I'm pretty sure endometriosis is still not on the disability list, like
It's not.
technically.
Mhm.
So, I mean, you can like when you apply for jobs, there's like a normally, I think on all job
Yeah.
applications now, there's like a
hmm
section for you to disclose if you have a disability or not. And there's like other, and you could put endometriosis, I'm sure, if you
Yeah.
wanted to.
Sure.
Um, and I've had people that are like, well, why don't you do that? Because then, they already know and then you don't like have to disclose it when you're hired. And I was like, well, like honestly, I was worried that, you know, it's
It would
not
be
an
used
official
against me.
disability and people would not accept that. And then also like I like you, I'm a very open person. So like when I started my job, like I mean, I told people like not immediately, but like I told my manager, I was like, hey, like there might be certain times where I have to like run out of the lab because I'm not feeling well or I might wear sweatpants to work sometimes if that is that okay? And they're like, we don't have a dress code, so great. But I'm like, some days, like, I literally cannot wear jeans because I'm so bloated. None of my jeans button. So
Right. You're like, this isn't gonna work.
I know. I'm like, ooh. So, but yeah, I have had a lot of people ask, like, how is it appropriate to disclose it? And I'm like, well, I think if you're comfortable talking
Yeah.
about it, then
And that's what I was gonna say. I feel like it's as soon as you're comfortable. Like I was kind of trying to like wade in the waters and like get a
hmm
feel for what things were like, what the environment was like, what the people were like. And then upon hearing about endometriosis specialist, I actually went to her and I was like, is this, can you guys please help me get an
Yeah.
appointment? And so that's kind of when that conversation started to happen. And then it was
Yeah.
like once I knew that I was going to be seeing this person and I was going to be having surgery, I was really like, okay, you know.
Yeah.
And people, I think, because I mean, when I first got the job, I was still having periods and I was, going through those symptoms. And so I think it was noticeable to people that I was going through something and no
Yeah.
one outwardly like asked. But eventually I just
Yeah.
got to a point where I was like, I'm going to disclose this information. And it makes me feel comfortable going into work that people know because like, if I'm to disappear and I'm gone for an extended period of time, like, that
Yeah.
I'm going through this, please come looking for me. Like something may not
Yeah.
be, you know?
Yeah. No, I was the same way. I mean, I feel like I've always kind of been that way with endo just because like I there was like one job where like I just didn't feel comfortable like outwardly talking about it. And then my manager, like in a one-on-one, was like, people think that you're flaky because you keep and I was like, oh, I'm like, no, like I'm puking in the bathroom. I'm like, I'm sick. Like there's the and they're like, he was like, oh, wait, what? And I was like, yeah, I'm like it was a mostly male team. And then I like had to explain what it was. And he literally was like, oh, we don't have to talk about like and I was like, no, like this is a chronic illness. It's not like my period.
Yeah. Right.
Um, so
It's not just about my uterus or
yeah, I was like, it's actually outside of my uterus, so
it's a
whatever.
whole body condition, FYI.
Yeah. Couple more questions for
Mhm.
you.
Yeah.
Hmm. How has living with a chronic illness, I mean, I know you have a couple, but
Mhm.
living with chronic illness in general, has that changed the way that you approach patient care?
Ooh, that's a good question. I think I got into nursing for, the very reason that I expressed that I just wanted to be there for people as they were
Yeah.
going through really difficult life things because I had gone through so many of those moments myself and I had so many wonderful nurses that were there for me along the way. And, when I started nursing, it was like, this is what I want to do. I want to be here for these people. So I don't know that I would say it's necessarily changed the way that I've given patient care. I think that it's like almost a superpower for me in the sense that like
Yeah.
I see these people and I'm like, you guys are freaking warriors, and I deal with a lot of cancer patients, young cancer patients, and it's also given me, the perspective of empathy in that way as well of there are people who are going through really severe, really life-altering things.
Yeah.
And I don't know what it's like to have cancer. I don't know what it's like to go through that journey, but I do know what it's like to be in the depths of something that feels so dark and so grim that you don't know if you're going to get out of it. And to be able
Yeah.
to be there for those people is such an honor and such a privilege to be able to do that,
Oh.
So one thing I absolutely love about my job is being able
Mhm.
to, be in those moments and to give that empathy to people where they might not be getting empathy otherwise. Because, sometimes people look at others with chronic illnesses and they're like, oh, here they go again, here's another
Yeah.
symptom, here's another and sometimes I just think like, well, what if that was me? I
Yeah.
think as healthcare professionals, we sometimes forget that these aren't textbooks. These are people, and the
Mhm.
textbook isn't always going to fit the person, and we have to look at everything as a whole. And
Yeah. I think a lot of healthcare providers specifically, like go through compassion fatigue.
yeah.
And I personally, like from any, I guess not any, but like most healthcare professionals that have chronic illnesses or that like experience chronic pain, I feel like they're just less likely to have compassion fatigue because like you experience these things every day and you are just like naturally so empathetic towards it that
Mhm.
you're probably always going to feel that way. But whereas like people that don't experience that and they, might go into it feeling very compassionate, but then it's just like an everyday thing. And you're like, okay, this is what I do every day. Like,
Yeah.
we know you're in pain, like type thing. So, yeah, I honestly wish that I don't know. I've technically been out of like healthcare for a couple of years now, like not working in it anymore, but I saw that a lot where you get
Yeah.
this like rep of like mean nurses and I'm just like I
Mhm.
think they're just overworked and tired
Yeah.
and are in compassion fatigue because they're like I gotta go to the next person.
Yeah.
Um I wish that that was something that, we looked like managers in healthcare like looked for and tried to like correct and be
Yeah.
careful of. But
It's the
Yeah,
system as a whole, unfortunately. I mean,
I
it's
know.
healthcare world is just
Yeah,
chaotic right now, and there are shortages, and when you're not getting that compassion back yourself, it can be really, really difficult. But I think, for me, it's always just I want these people to feel safe. I want them to feel
yeah,
like they have somebody who believes them because I know what it's like to not
yeah. You know
be.
firsthand, so you just, I don't think that that empathy can really go away when you, like, you don't
Yeah.
have to try, you know?
I guess like a good example of this is we see a lot of hemorrhoids, right? Like we're a colorectal surgery
Yeah.
department, so we get a lot of like rectal bleeding and hemorrhoids, and sometimes it's like, oh, like another hemorrhoid, but sometimes it's like, okay, but these people, well, more often than not, sometimes we're finding these hemorrhoids aren't hemorrhoids at all, and they're anal cancers or rectal cancers, and you're like, whew, I don't think this
Yeah,
person anticipated coming into the office today and hearing that news, and it's like
yeah,
you really just have to put yourself in their shoes. And I don't think I put myself in other people's shoes, but I don't feel like I've ever really had to do that fully because I feel it, and
yeah,
I feel it with that's like.
yeah, yeah. What it's like to hear like life-changing news and like, yeah, I get it. What changes? This is kind of a loaded question, but what changes would you like to see in the healthcare system regarding endometriosis awareness and like endometriosis patient care?
For one, I would love to see like it broadcasted
Hmm.
everywhere. Like endometriosis is a chronic illness. These are the common symptoms of endometriosis, and this is when you should see a healthcare professional. And granted, I understand that that information is out there, but SecMD or the Endo Foundation of
Yeah.
America, like they do such a great job of getting information out there and like running, 5Ks or anything to help raise awareness. And I just feel like that should be the standard across the board is getting information out and
Yeah.
seeing patients and believing patients. I think another really difficult thing is I know where I am from, there's very few endometriosis specialists. I would love
Yeah.
to see an uptick in the people who are specialized in endo and who are able to detect that sort of thing because I think a lot of it is that they're so overwhelmed with the patient load and there's not enough surgeons to help kind of
There's
mitigate
not.
and take
Yeah.
care of the patient population, which is another thing, right? Because then they're getting offloaded onto these OBs, which again, no problem with that, but they're not specialized in looking for those things.
Hmm.
I think that it's just, education, information is so important when it comes to this. You guys over on the West Coast, I feel like you do so many amazing events, and it's something that I definitely want to get into over here, but I don't know
Hmm.
how to start, and
Yeah, there is so much like advocacy and like
Mhm.
surgeons out on the West Coast. Like it just feels a little bit more progressive. And I definitely felt that, like being from Michigan and being from like the Midwest and the East Coast and all that stuff, like there's just really not.
Yeah.
I don't even actually know if there's any specialists in Michigan. Like I'll have to look that up, but I really don't know.
I think there's a few at the bigger hospitals like U of
Like
M.
maybe U of M. Yeah.
Yeah, because I know our colorectal surgeons kind of work,
Yeah.
but I mean it's few and far between for sure. I think that advocacy and education are just like two things that we have to continue to fight for. We have to
Yeah.
continue to get the word out. We have to continue to empower people to find answers and to not give up on finding those answers. It's so important. And if
No,
I had a few things that I could say to people that are currently going through endo or who are searching for an endo diagnosis, it's do not give up. I
yeah.
know that it feels daunting and it feels exhausting, and you wonder if it's ever going to be you getting to share these stories. And I promise you that there is someone out there that is going to believe you, and it's going to be a dogfight sometimes, but do not give up on yourself. You know yourself better than anybody else. You know your body better than anybody else, and don't let them tell you that you don't. Because if I would have sat back, if Lexi would have sat back and just listened to everybody else, tell us that it's in our heads, it's a normal
Mhm.
womanly thing, that birth control is going to solve the problem, we would not be sitting here today having these discussions.
Yeah.
and these sorts of things. So don't give up on yourself. Keep fighting regardless of how difficult it might be, and reach out to people. Like,
Yeah.
Lexy can share my Instagram. They have great stuff out there. Please reach out to people, lean on community, lean on friends, and just take care of yourself because it is very
Yeah.
difficult.
So well said. Round of applause. I know that I feel like that is the most important stuff, and having a community can make it all just feel a little less heavy
Yeah.
sometimes. So yeah, where can people find you? What's your Instagram?
My Instagram is Megatron, so Megatron, two underscores.
Perfect. I'll put it in the show notes too, so people can just like
Okay.
copy paste it. Amazing. Thank you so much for coming on the podcast. This was so
Thank you
fun.
for having me. It was
Yeah.
wonderful.
Yay. Thank you guys so much for tuning in to the Chronic Chronicles. If this episode resonated with you, be sure to subscribe, leave a review, and share it with someone who needs to hear it. And as always, you can follow us on Instagram at Chronic Chronicles Pod for updates, resources, and all things chronic illness. Until next time, be gentle with yourself and never stop advocating for your body.